Hello, Stuart Simons here, your VCE with VA Claims Insider. Wanted to help you prep for your upcoming mental health assessment. We're going to cover what you should expect, what you should share, how you should share, and how your experience or your chronic pain has impacted your life today. Remember, the VA needs to know how you're impacted by your disability. So let's cover what you should expect. The mental health assessment is a service that you as a customer have paid for. With that said, the psychologist that will be conducting your assessment has your best interests at heart. Now, this does require effort on your part though. You need to be open with the doctor. I realize that it can be difficult to be open to a complete stranger, but remember, these are mental health professionals, okay? They have heard it all before. Now, how do you start the assessment? Look for that confirmation email. There's a link in there. You needed to click that link in the appointment confirmation email that the doctor sent you. That link will take you to a web page and will automatically activate your camera and your microphone. You'll be able to see the doctor and they can see and hear you. This session has to be videotaped. That's a requirement by the VA. The assessment will start off with a brief set of questions to get you comfortable. Then you will have the opportunity to share the experiences that you went through during your service and how they impact you today. What you should share. Let's cover that. The assessment will take 30 to 60 minutes, and in that short amount of time, the doctor needs to hear about your whole military service. They need to hear about how you're impacted by your experiences or events in service, specifically the events that happened or the chronic pain you suffer with. This is where veterans can have a hard time. I understand that it's not easy, and trust me, so does a psychologist, but you need to share your feelings. You need to share how you feel today about things. They are good at getting you to relax and establishing rapport. This is your chance to share it all. Focus on your time period of military service from the start to where you are today. That's what you want to share with the doctor. If you had a combat tour or combat experience, share that as best you can, of course. If you're dealing with chronic pain, share that. Share how the pain makes you feel today. If you're dealing with military sexual trauma, I know it's hard, but share that as well. How you should share. You need to share to the doctor through the lens of your bad days. You know what I'm talking about, those days where you don't want to or can't even get out of bed. Those days where maybe depression or anxiety is just too much. They need to hear about it. They need to hear how hard it is for you and how that has a direct correlation on your life, how this disability impacts your life today. Even if you're not depressed on the day of the assessment or anxious, you need to share it through the lens of that day. So for me, I deal with anxiety. When I'm in a crowded place, my anxiety creeps up. I get irritable, angry, snippy, and when that happens, my wife knows I need to go somewhere quiet so I can get myself to relax, regain control. That's what I shared when I went through my assessment and my C&P exam. If chronic pain or somatic symptom disorder is what your claim is going to be focused on, then you need to share those days where the pain is too much, where you don't feel like it's worth getting out of bed. Maybe you have to walk off the job on a regular basis. The doctor needs to know that, okay? Maybe when the pain comes on, it makes you anxious, irritable. You can't get along with your coworkers. Share it with the doctor, all right? That's how you need to share it. Even if you're not having a bad day on the day of your assessment, you need to share about those bad days. What you share needs to be through the lens of your bad days. As a company that values integrity and ethics, I tell my clients you never have to lie. You don't need to. I know you, if you are here right now watching this video, it's because you realize you're dealing with some issues. You've had a bad day or two. Just because you feel good in the moment doesn't mean your bad days won't happen again in the future. You and I know they will. Daily life impact. Hey, we're almost done. Stay with me, okay? I know you've heard this from Brian's videos, maybe on Facebook or YouTube, and I know we've probably spoken about it through email or on our initial call, but this is what you got to share with the doctor. Social impairment. Fancy medical term for the personal relationships in your life. Those relationships with your spouse, family, and friends. An example of social impairment would be since your period in service, your combat, whatever it is, you now lack the patience maybe to deal with family members at family events. Maybe you have a hard time making friends. Maybe you've driven away all your old friends because of your behavior. Maybe you're irritable, have angry outbursts. The doctor needs to know that, okay? Occupational impairment, that's the fancy term for when your work is impacted by your disability. Just walking off the job because you deal with anger, yelling at your boss or coworkers, especially when you didn't do that in the past, but you do it now since military experience and service. That's occupational impairment. Another term you might be familiar with or not familiar with, flattened affect. This is when someone starts to not demonstrate or show emotion in normal circumstances when they should. So an example of that would be you're at your own birthday party, you just don't care though. The people around you, they can tell you don't care. You seem uninterested. That's called flattened affect. Make sure you share that with your doctor if that's something you experience. Now, not everything in this video might apply to you, because I'm talking about both, the mental health rating guide for both PTSD and somatic symptom disorder chronic pain. But I've probably sent you a copy of the rating guide. Take some time to look it over, look at those terms. In closing, be open with what your experience was like. The stressor, the event. Share your bad days. Share what the chronic pain makes you feel like. Share what you suffer with. This is your chance to be open and honest with someone who truly wants to help you. After your assessment, you can expect to see your DBQ in about 48 hours or so. I'll be CC'd most of the time on an email. Take a look, review it, check for spelling, all that stuff. Your assessment's going to go great. Once that's done, I'll continue working with you. We're going to get your claim built, get you submitted. Until then, focus on your assessment, and we will talk again soon.